10 ways to deal with hormonal imbalance, how to balance your hormones. If you're coming from TikTok or my Facebook or any of my other platforms, please, this is a different video from where you're coming from. So please don't skip any part. This is a different video. I'm going to be telling you everything about hormonal imbalance because all of those places I rush because of the time frame. Okay, now I'm going to be telling you the causes of hormonal imbalance, symptoms that may suggest you have hormonal imbalance, because most people don't even know that they have hormonal imbalance. All they know is that their period doesn't come out when it's supposed to. They are having hairs all over, they are having pimples, acne all over, they are gaining weight even when they are not eating, and their breast discharge is coming out of their breast, so they don't even know. So I'm telling you symptoms, causes of hormonal imbalance, how to balance your hormones. Okay, food to eat to help you balance your hormones, lifestyle. These are the things we're going to be discussing. Please make sure you like this video and subscribe if this is your first time, because we do health, everything about health, okay, women's health, and mostly your organs as well. My name is Nurse Mary. I'm a nephrology nurse, basically dialysis, kidney, everything about kidney is my specialty. So if you have questions, please do drop them in the comment section. Now, when they tell you that your hormones is imbalanced, when your doctor say you have hormonal imbalance, or you've been hearing hormonal imbalance, the question is, which hormones is imbalanced? If you've been told that your hormones is imbalanced, please ask the doctors, or try to, with the hormonal essay, ask them which of the hormones is, let them explain to you. So this will help you know what to do. So when you've been told your hormones is imbalanced, find out the hormones that are imbalanced. That's number one in dealing with hormonal imbalance. Secondly, hormonal imbalance simply means that there are some hormones that are higher than normal, or there are some hormones that are lower than normal. Every human being needs hormone. We have about 50 hormones in us. Hormones are like chemical messengers. They help us deliver messages to the body and when to need, like a circadian rhythm. It helps your body function properly. So when each hormone is higher or lower, your body won't function optimally. Now, hormones are very necessary in reproduction, giving birth. That's why most people are having low libido and all, growth and development, your body system, your muscles, everything. It is very important. Now, having learned about all of these things, these are symptoms that may suggest that you have hormonal imbalance in women. It can also be in men. Number one, weakness. Sometimes you're overly tired. Okay, you wake up now after having a long sleep. You wake up, you are now tired. You can't do the normal activities you want to do. You're always tired. Number two, you can't sleep when you want to sleep. Okay, at the end of the day, you feel like you were somewhere, you're feeling sleepy. Immediately you get home or you now want to sleep, you close your eyes, you can't sleep. Okay. Number three, facial hairs. This can be also a sign of polycystic ovarian syndrome. We've discussed about PCOS. If you don't have that video, please locate it. Acne breakout. You're always breaking out. This one is very important in the supplements I'll be telling you for people that are always breaking out. Okay, so the next thing, suggestion of hormonal imbalance, is your period is always missing. It doesn't come when it's supposed to. 3, 4, 5, 6 months your period is coming. The next thing is you're lactating, high prolactin. Okay, this is another sign that you're lactating when you're not pregnant. Okay, or you didn't even give birth. So this is a sign that you may be having hormonal imbalance. There are so many other signs. For instance, serious heavy bleeding. Okay, you're having heavy bleeding, or you're having menstrual cramps, or you don't have libido to have sex, low libido. Okay, or you don't get wet. These are series of things that hormonal imbalance can do in women. Okay, so now, having known about this, if you have been noticing one of these signs, you may be having hormonal imbalance or polycystic ovarian syndrome. Okay, now let's get to how you may balance your hormone. Before we get to the how to deal with hormonal imbalance, 10 ways, even not even 10 ways, about 15 ways, I will open your eyes about hormonal imbalance. If you do these things, you will be fine by God's grace. We're going to be looking at causes of hormonal imbalance. Okay, now, number one, it can be hormonal changes during puberty. A woman just started seeing her period, her hormones will fluctuate, change. That's why her period will be like until it balances. Puberty, pregnancy, there's hormonal fluctuation, thyroid issues. Some people have thyroid, the thyroid, gland that produces hormones is either having issues, so there's underproduction or overproduction. You had accident, you had injury, kidney disease, diabetes, all those things, there are a lot of things that can cause tumors, cancers, terminal illnesses, okay, can cause hormonal imbalance. So this is why I suggest that before you start treating, you have to go and meet a doctor, find out the kind of hormones that is imbalanced. If it is just hormonal imbalance by some certain, I forgot to mention some certain medications too. Example, these pills, okay, after sex pills. That's why I tell you to be very careful while taking these pills. Don't take all these after sex pills in the morning. Please be very, very careful while taking them. Let it be prescribed. If you're on medication, it shouldn't be more than 3 months. Most of these things can cause high blood pressure, okay? If some is given to you 3 months to regulate your period, okay, fine. But so those people that use emergency contraceptive, early morning pill to prevent pregnancy, shouldn't be taking more than 3-4 months because of your blood pressure, okay? So some medications, some BP medications too, some diabetic medications too can help fluctuate your hormones. So have you known about this? So you have to be certain on what is causing yours. Having checked and the doctor just said is prolactin or proestrogen or testosterone is higher, you now begin to know what to do, okay? So having said about this, let's now get to 15 ways, because it's more than 10, to deal with hormonal imbalance. Please listen attentively, don't skip any parts, because this thing I didn't write them anywhere. I didn't go and memorize it anywhere, or I'm reading it from a website. No, this is, I've had hormonal imbalance. I'm a living testimony. I do have it sometimes. It comes and goes if I subject myself to the things that will cause it, okay, stress and all. So please listen, because the part you may skip may actually be the most important part. And if you've not listened to causes of hormonal imbalance, symptoms of hormonal imbalance, please make sure you go back and listen so that this part will make sense to you. Before I make this, people that are using, I'm not depicting the value of using herbs, because I'll still be mentioning herbs in hormonal imbalance, but you have to be careful. Most of you have polycystic ovary, or you have cysts, and then you take things like cloves, things like some ginger, I'm sorry, garlic. I'm going to say garlic here, but some of these things make burst your cysts, okay? They are good, no doubt, but you have to, your friend took something shouldn't mean you should take them. You just have to be very careful, so you don't take this thing and complicate matters. That's why most people, they don't have painful period, but now their period is painful. In fact, they feel fluid. Their cyst before is dry, now there's so many, it has enlarged and is becoming bigger, okay? Please be careful. I'm going to mention herbal, of course, all these natural herbs is good, but there are some that you shouldn't take based on your condition. So your doctor should explain to you better. Having said about this, that now these are the things that will help you. Number one, rest. Rest is very important in dealing with hormonal imbalance, okay? When you're not resting, there's a hormone that is called cortisol. Cortisol is being produced, making your body think that you're going under stress. The more cortisol is produced, the lower the progesterone, okay? Your progesterone level will be low, leading to estrogen being low. Ovulation becomes very hard, okay? Your hormones is scattered, period, everything is just like this, okay? So please make sure you rest. And cortisol also, before you know it, insulin, you will start having insulin dependent diabetes and all of those things, just because of you're not resting, okay? So now sleep at least 7 to 8 hours in a day, whether night, morning. Sleep, uninterrupted sleep. This is me. Each time I don't do this, because I'm studying, I will see acne coming out. Meanwhile, anything I tell you about hormonal imbalance, take it, because I am having hormonal imbalance. I was having it sometime, when I deal with myself. If I indulge myself in those activities, it comes back again, okay? So now please make sure you sleep adequate sleep. The next thing is, try to cut back on your weight. Try to reduce your weight. I know hormonal imbalance also makes you gain weight even when nothing is happening, but try to work out, do exercises, light exercises. Try to have more muscle than fats. Fats reduce more muscle. Like, so when you go to the gym, you low impact exercise. Okay, so drink a lot of water. Water will help you. The next one, water. Now avoid or reduce the way you take sugary drinks, Coke, Fanta, Sprite, beverages. Reduce the way you take cola products. This makes you have it's I don't know how to explain it, but please, especially if you're having PCOS, hormonal imbalance, reduce these drinks. Okay, take more of, you can take more of cucumber. You can make a smoothie that has cucumber, pear, avocado pear. You can put a little avocado pear. You can put a little bit, maybe 1 or 2 pieces of ginger, if of garlic, 1 garlic if you can, if you're not having any polycystic ovary. Blend them together. Okay, put celery, all those green smoothies. You can just add maybe banana to make it, to sweeten it. Okay, this thing will help you instead of taking sweet drinks. Please stop. Mostly anything that is not sweet helps you. Okay, that is not sweet just helps you. Now please take good oil. Hormones is made up of oil, so you need oil. Good oil like olive oil is good for you. Coconut oil is good for you in cooking. Okay, avocado pear is good for you. Okay, now I'm coming in the case of supplements. Okay, supplements, I'm coming there. I don't want to, but omega-3 oil is very wonderful for you. Now the next thing that you need to do in dealing with this is try as possible as you can to monitor the things that go inside this your mouth. Reduce the way you take simple carbohydrates. Pizza, that one is cancelled. Noodles all the time. If you must take rice, take basmati rice with vegetables. Okay, take high fiber food. Very beautiful. Now try to take what is this, chia seed. Very beautiful. It's high in fiber and it's very, very beautiful. Okay, you can mix it in your smoothie or put it in your rice or whatever. It is good. It will help in balancing your hormones and it is high in fiber. Take high fiber foods other than simple carbohydrates, that drinks that are filled with loaded carbohydrate. It will make you gain weight and disrupt your hormone, especially if you're trying to conceive. Now, very important, please, smoking is a no-no. If you are smoking, please don't smoke it. Or is a no-no. Please, you can take it once in a while, but it's a no-no. It's filled with empty calories. Okay, for now, if you're battling with hormones. Okay, now finally, please take more of fruits, vegetables. Okay, sometimes you can use cabbage and make stew. All these things, it will boost your ovulation. I'm telling you, it will boost your ovulation. Just take, no need of putting mayonnaise. Put cabbage, green peppers, carrots, green peas. These things will boost you will feel full. Before you know it, your taste for sugar will start reducing. You will stop having cravings for sugar, because it's also part of the hormonal imbalance thing. Okay, having cravings for sugar. But if you start eating this thing, force yourself. Before you know it, sweet things will become so sweet for you. Now finally, please do a test. Meet a doctor, do a test, find out the hormones that are imbalanced to help you. There are the ones that require some drugs to bring it up. For instance, of the ones that there is high prolactin. Okay, if you're discharging breast milk without pregnancy, you can be prescribed cabergoline. I'm not saying you should go and buy cabergoline, but because your doctor needs to know your health condition before prescribe. That's why we don't prescribe online. Okay, so please be aware of this. Now, having known about this, we're going to be talking about the supplements that you have to be taking if you have hormonal imbalance. Very important. I'm not prescribing, but these are over-the-counter supplements that are nice. Number 1, zinc. Very beautiful. However, any of these supplements, before you take them, I forget to mention, make sure you meet your doctor, okay, to say that you're okay to take them. Zinc helps stop acne. Okay, also helps improve your system. It helps you a lot. Number two, vitamin C, wonderful. Make sure you take a lot of water before you take vitamin C, and don't take more than 1000 milligram. Remember, vitamin C, when abused and not taken without water, causes kidney stones. Okay, so vitamin C 1000 milligram, zinc 50 milligram, vitamin E, wonderful. Omega-3 acid, make sure you get the one that has EPA and DHA, very, very important. Okay, now onions is also very good for you. You can put onions in your salad when you don't cook it, when you're doing this thing. It just, a help of making you ingest more. Olive oil in your salad, a way of helping you ingest oil that you need for your hormonal balancing. The next supplement is magnesium. Beautiful. Magnesium is good for you. Vitamin D, okay, but for me I take vitamin D is good, but for me I take vitamin E, omega-3, zinc, vitamin C. I take them. So you can take them maybe every other day, maybe like 5 times in a week. But that's what I'm saying. You have to meet your doctor to prescribe for you and guide you. Okay, however, these are supplements. And then please be mindful of the concoction you take. Herbal concoction, I'm telling you, be mindful. Oh, these people have met me to do advert for them, because I'm in nephrology. Not just your kidneys. I'm not talking about, of course, these things can damage your kidneys. Of course, these are natural, but you don't know the amount that is good for you. Okay, they don't have dosages. They can say take 2 shots. What is 2 shots? Or take 2 spoons. What is 2 spoons? 2 spoons can mean about 10 paracetamol in your kidneys. So please be careful. All this concoction, please be very careful of them. Okay, now like I said before, you have to take onions is very beautiful for you. Onions is good for you. It will help you a lot. Now, having known about this, if this video has made you smile, please like and share. Make sure you join our family, subscription family, where you can have my number if you want to talk to me, or if you want me to direct you to a consultant. Just join our family, subscribe to our family. But apart from that, you can subscribe and like this video.